Good morning. Three-parent IVF babies. Babies have been born using a new IVF technique to prevent rare genetic diseases. So at the start of every video, there is a disclaimer. I'm James Stange, I've got a PhD, and I've been an embryologist for more than 50 years experience working both in laboratory and in education and training. And I'm using this experience to help you on your IVF journey. These videos for my YouTube Fertile channel is an attempt to bridge the gap between information you may need for your fertility treatment and the most recent publications available to your clinic staff. I'm not a medical person, but this information is not medical advice, but it may help you in asking questions about your treatment with your doctor. I hope it helps. So this page is allocated to supporters of my channel. So I'm just starting out, but if you want to promote your company or clinical product, this may be just the place. Support me, and in so doing, will support other informed IVF clients. You can click subscribe or become a sponsor, or you just may like to make a donation to help others on their fertility journey. So three-parent babies. What does this mean, and does it apply to you? This video presents the results of the first trial that had just been published by all these authors entitled Mitochondrial Donation and Pre-Implantation Genetic Testing for Mitochondrial Disease and published in the New England Journal of Medicine. This is a subscriber-only article, so it's not available to the general public. So this video is attempting to bridge this gap between the published information and what I think you may need to know. The technique involves the three sets of DNA in every cell. These are the three parents. In this technique, the couple make an embryo, and on the first day, when the two sets of DNA are visible as pronuclei, in a donated oocyte, the DNA are removed by aspiration with a very fine needle, and then the two pronuclei from the client's DNA is aspirated from the mother's embryo and transferred to a healthy enucleated embryo. It's basically transferring the chromosomes from one egg to another. So when they talk about three-parent babies, what are the three sets of DNA? Well, one set comes from the egg, which is the maternal DNA. Another set comes from sperm, which is the paternal DNA. And the third set of DNA comes from mitochondria, and that is also maternal. So one of the quirks of nature is that all the DNA in an oocyte, that are mitochondria, always come from the egg, and the sperm mitochondria is never transferred, or if it does, it's removed. And the mitochondria's role is to provide energy for every cell, but sometimes there are mutations that occur in mitochondria that have the potential to affect every cell in the embryo and the future child. So in this graphic, we can see a early egg, and here's the maternal and paternal chromosomes, the DNA, but these small organelles are the mitochondria. The green ones are the healthy ones, and the red ones are the unhealthy ones. And you can see that if you get lots and lots of oocytes, some oocytes by sheer chance will have lots of healthy mitochondria, and they will produce a healthy child. You may get some embryos where there's a mix, but basically this may become healthy or become worse. But some eggs in the same cohort may have a large number of bad mitochondria, which will produce an embryo which is not healthy and a child with mitochondrial disease. And as we've said here, that every egg is different in the amount of bad mitochondria it may contain. And as the embryo develops, sometimes the bad mitochondria increases in proportion to the impact on the health of the future child. It's suggested that maybe 1 every 5,000 babies is born with a mitochondrial disease. I can say from experience that after 40 years and 50 years in IVF, I know of one case that I've produced with mitochondrial disease, twin children, a male and a female. The female has grown up to be perfectly healthy, but the male developed some form of mitochondrial disease and passed away at 5 to 6 years of age. So I'm aware of the implications of mitochondrial disease and this treatment. Okay, so what is mitochondrial disease? So you've asked Google, it'll tell you the mitochondrial disease is a group of genetic disorders that affect the mitochondria, the powerhouse of the cells, causing them to produce insufficient energy. This energy deficiency can lead to a wide range of symptoms affecting various organs, including the brain, muscles, heart, and more. While there's no cure, management focuses on supportive therapies to address these specific symptoms and try to improve the quality of life. The reality, though, is that many die with a long wasting disease. So you may ask, what are mitochondria? Mitochondria are the small, tiny structures that appear in all cells, often between 2 and 10,000, and they're responsible for generating all the energy that's through a process called cellular respiration. They contain their own mitochondrial DNA, which is separate from the DNA found in the cell's nucleus, but they do interact. And more information can be found at this site, mito.org.au. So if you have a history of mitochondrial disease in your family or whatever, and you approach your clinician and counsellor, basically there are two options. And once again, this is not medical advice, this is more scientific advice. And all conversation need to take place with your clinician. But the first option is to use donated eggs to ensure that there's no trace of affected mitochondria. And this means there's a loss of maternal genes, requires an egg donor, and they may have their own inherent genetic risk. If you choose to make your own embryos and have them tested by PGT-A to the extent of bad mitochondria, if low, then you may run a risk and have them transferred, or you could discard them. And the third option is to use your own DNA but have them transferred to a donated enucleated embryo. So this is what it looks like. This picture came from an article summarising this paper. And you can see here an oocyte, and these two circles are the sets of DNA both from maternal, the mother and the father, the egg and the sperm, which have been sucked out or are being put into an oocyte. The mitochondria, you can't see it here, but they are all the cytoplasm is filled with mitochondria. And as I said, it's often between 1 and 10,000 mitochondria per egg. So the background of the study, as the authors have said, so this is a quote, children born to women who carry pathogenic variants of mitochondrial DNA are at risk of a range of clinical syndromes collectively known as mitochondrial disease. Mitochondrial donation by pronuclear transfer involves transplantation of the nuclear genome from a fertilized egg from the affected woman to an enucleated fertilized egg donated by an unaffected woman. Thus, pronuclear transfer offers affected women the potential to have a genetically related child with a reduced risk of mitochondrial disease. So this is what it looks like. This is the oocyte on day one, or the embryo on day one. You can see the two circles of chromosomes is called pronuclei. One is a wrapping up all the sperm DNA, and the second one is a wrapping up of all the female chromosomes. At this stage, they're just being repaired, ready to fusing. And what you have is a situation where you take a donated egg, you fertilize it with some source of sperm, presumably the client's male. Then when the pronuclei are formed, they're removed, taken away. So this egg is now what they call enucleated. And then the affected woman produces oocytes, which are then injected with ICSI. And on day one, when it looks like this, these two pronuclei are removed, sucked out. There's a small little vesicle. You can see the two sets of chromosomes, maternal and paternal, and a little bit of cytoplasm, which is injected into the enucleated egg to form a new embryo. And surprisingly, in a large number of cases, this embryo will continue to divide. So you're left with an embryo which has the maternal DNA, the paternal DNA, and the mitochondrial DNA, most of which, the blue, have come from the egg donor and are presumably healthy. But there may be a small residual number of affected DNA in the mitochondria, which has been brought over with the transfer. So this new technique has helped 8 babies in the UK avoid serious inherited diseases, and the scientists are naturally calling it a breakthrough. All 8 children were born using the method that uses DNA from 3 people, the mother, the father, and the donor. and the goal was to prevent babies from inheriting mitochondrial diseases, a group of rare and untreatable conditions passed down through the mother. These diseases can cause serious health problems like vision loss, diabetes, and muscle weakness, but they also result quite commonly in death. Experts say about 1 every 5,000 babies are born with a mitochondrial disease, but in my experience, I've had 1 in 50 years. A lady had 2 babies, a daughter and a son. The daughter's perfectly healthy, but the son started developing wastage disease from when they were 1 or 2 or 3 years old and passed away not long after. So I've had personal experience with this condition. This technique remains illegal in many places, including the USA and France, and some have called these 3 parent babies, but researchers say this is misleading. And as I said, this first ever results of the trial have now been published in the New England Journal of Medicine. So the trial took 22 women who received treatment at the Newcastle Fertility Centre in the UK. 8 babies have been born, so you got 8 babies from 22 treatment, which is around about a 33% pregnancy rate, which is seriously impressive. Had 4 boys and 4 girls, and their ages now range from 6 months to over 2 years. Tests have shown that 6 of the 8 babies, the faulty mitochondrial DNA was reduced to 95 to 100%, was virtually eliminated, and reduced by 75% or more in the other 2 babies. All 8 children are currently healthy, although one had a temporary heart rhythm that's been successfully treated. The technique was effective in reducing transmission of the mitochondrial disease between mother and child, and the scientists say the children will be followed up over time to make sure they stay healthy, as when you would expect in any trial. In fact, they'll be followed for the rest of their lives. 3 of the babies did show signs of something called reversal. It's a phenomenon where the therapy initially succeeds in producing an embryo with a very few defective mitochondria, but by the time the child is born, the proportion of abnormal mitochondria in its cells has significantly increased, according to Dagan Wells at the Oxford University. This doesn't mean the treatment failed, but experts want to study it more. The results are giving families some hope, but not much. So some of the comments from Clinical Advisor, they say it's a very important reproductive option for families experiencing this devastating mitochondrial disease. But other commentators have said that only people with a very high risk of passing on the disease will qualify for the treatment, and it's not yet a method that should be used in general infertility workup. So my comments on this paper, and once again, this is not medical advice, this does not apply to infertile couples unless there is a history in your family of mitochondrial diseases. If you choose to use donated oocytes, there will be no risk of your child being affected by bad mitochondria, but may introduce other risks and you lose the maternal inheritance. If you choose PGTA to have your embryos tested and select those with little or minimal bad mitochondria, then there is a risk of reversal. If you choose pronuclear transfer, as the topic of this paper, then there is a risk of some carryover of bad mitochondria and reversal that may affect your child or future grandchildren. Lots and lots to think about. I hope this information has been valuable, and if you like the information provided, please tell other IVF clients about this service and please subscribe. Bye.